Sorry, I can't see the chat anymore. But can y'all see my screen? Yeah, no, that's also Jiro. Like, you're right. I mean, Cynthia, I wouldn't say any of it's easy, but like, I don't know. I studied the night before and like we're doing all right. Which class has the most assignments? Community has stupid like freaking discussion posts, but PD has these like clinical assignments. Like you have to do them not for like your grade in the class, but like to get your clinical hours. They're like ATIs, and they make me want to like actually cry every day. There's four of them, I think, and they just take long. They're just silly. But yeah, I can't post the Kahoot, but I would suggest playing it. Okay, I think I did like one ATI this semester, if I remember correctly. Um, there is one like that where it's like three. Y'all did three? Oh, were some of them for OB that were like super easy, and then there was one that was like super duper long? Yeah, okay. So the super duper long one, you do one of those again at the very beginning of the semester, and then there's like ones that take like half as long. Those are the PD ones that I'm referring to. Yeah, the first one took me like 8 hours, and then all the ATI ones took, or the PD ones take me like 4 to 5. I know. It's like actually sinful. I know. I know. It's awful. Sorry, I'm trying to like join this Webex on my iPad so I can talk to y'all in the chat. Oh, I'm already on it. It's funny. Okay. What chapters are on this test? Laura, that's hilarious. I love that. 2017 through 29. Oh, because y'all have quiz stuff on it? Oh, I'm so sorry. Okay, well, luckily y'all have our PowerPoint for those. Honestly, I feel like they told us that they were gonna have stuff from previous chapters and they didn't, but who knows? They are psych professors or something else. Okay, I'm gonna give us like one more minute because I think we stopped. Ooh, let me read the names. Oh, so cute. Wait, why do you feel judged? Did I make you feel judged? I hope not. Don't be scared. Kiki. Okay, we will start in like 30 seconds. Say psych right now. I said it. I said psych. Is that what you wanted? I cannot tell y'all how weird it is to just like talk to yourself. Like, y'all could think I'm like the strangest person on earth and I would never know because I'm literally by myself right now. Where's Brooke? Great question. Her and her boo thing are having a day, so we support that. I know. I know. We all love Brooke. She's freaking amazing. I'm obsessed with her. Okay, we're starting. Is everyone ready? I'm gonna assume so. If y'all have questions, put them in the chat. I'll try to answer them. Also, I made these like super, super quickly. So if you don't understand what the question's asking, just let me know. Oh, next time I get the night off? Oh, that's sweet. I'm sure Brooke would do that for me in a heartbeat. I'm Oh my god, I keyed this wrong. Ugh, I'm so sorry. I hate that for y'all's scores. But for the 4 people who put that, you're welcome. It 100% reduces appeal. I'm trying my best, y'all. Trying my freaking best. It does reduce appeal. Please know that. I will fix that. I questioned everything for upset. Honestly, me every day. Okay, don't look at people who got it right. Um, okay, if you wanna quit smoking, what is the best way? Y'all are so smart. Holla. Okay, what do you tell an alcoholic who doesn't want to stop drinking or doesn't accept that they have a drinking problem? Amazing. Did I make that one too easy? But maybe you should know that one for some odd reason. Harm reduction for educating a client addicted to heroin. What, like, sorry, that makes no sense. But, like, pretty much, what do you want to teach a patient who's addicted to heroin to help them out? Yes, we are going to advise that they use a needle exchange program because that's a lot safer than using dirty needles. Okay, patient arrives. They have tracks on the arms, and the friend reports he just shot up heroin. What do you give this patient? And I would know the difference between the ones that sound similar because sometimes you can mix them up if you're stressed out during a test. Wonderful. That was on the slides in red. Okay, caffeine withdrawal symptoms. Now, this is the one that I need to double check, but I'm pretty sure it'll come up for y'all. Oh, it's a SATA. It's a SATA, by the way. Sorry if that wasn't clear. Okay, great. I will double check this, but I'm pretty sure that's right. It was on like my Kahoot whenever the tutors tutored me, and I'm pretty sure someone said it was on someone else's tutoring. So, yes. Okay, great. Thanks, Jessica. Which are stimulants? This is a SATA. I was making this so fast, I couldn't like write full sentences or put if there were SATAs. Amazing. Heroin. I do not believe that it is a stimulant, but I will look that up. I don't think so. It depresses your central nervous system. What would I do without flow? I do not know. Okay, step 2 of Alcoholics Anonymous. There are different steps. It's a 12-step program. I remember this being a super specific question, so just know it. Sorry, it's so specific. I'll tell you. Okay, so yeah, there's a higher power that can help me. So just kind of think of like you're raising both hands. There's two hands in the air. There's a higher power. We'll go with that. Like specifically step two. Yes. There are 12 total steps. And I think for psych, you'll have to go to an AA meeting, right? I did. It was an experience for me. I'd love to hear y'all's. Okay, a patient comes in and their blood alcohol content is 0.1%. What like clinical manifestations would that be? I shouldn't have given away all my Kahoot questions in tutoring. Like, what the heck, Madeline? I'm like emphasizing them because they're important. Yeah. Okay, so what are signs and symptoms if a patient comes in with moderate opioid withdrawal? And I know it's so specific, but I promise to link me later. And a good memory for trick for this is opioid has two O's in it, and just think of like pupils, eyes, do with that as you will. Okay. So someone in the chat say the other name for this one that we talked about in tutoring. Come on, guys. Starts with an A. Okay, great. Yeah, it helps prevent you from drinking. Bonus question, do you know why? No, I love the honesty. Yeah, the side effects. It makes you feel like trash, so you're not gonna want to drink. Exactly. Exactly. Y'all are amazing, perfect, and beautiful. Okay, an anticholinergic medication is given, and they have this dry mouth sign and symptom. How would you like help the dry mouth? Oh, this is a saga. I'm literally the worst. I forgot to tell you all that. Okay, yeah. So chew hard candies and have them rinse with the glycerol mouthwash. Okay, this is oddly specific. I promise. Just remember it. Common delusion for an elderly person. Fun fact: I used to be really scared that not monsters lived in my closet, but ET. Like I'm truly like still terrified to this day of ET. I refuse to watch that movie. Yes. It is that their roommate is stealing their clothes. Sorry, it's specific. Just go with it. Okay, what do you ask a patient to assess their IADLs? Nicolette, I don't even know what the Coke scene is because like I truly cannot watch the movie. And Flo or anyone who's not doing too hot on this, it's not that you don't know anything, it's that this stupid test is so specific and we're trying to help you out. So don't be down on yourself. Just review this a couple times before the test. Okay, a patient with dementia is dizzy. What do you assess for? This is orthostatic hypotension. Overdose is a great second thing, but always assess for those vital signs. Also, after this, if y'all have specific questions about like a specific content area, I can try to like figure out what I think is important from it. So just let me know. Okay, for age-related changes, what would be like a cognition and intellectual performance change that's age-related? Yes. Do y'all know what the name for that is? That I told, yeah, I told you to remember that. Great job. What medication taken for Parkinson's disease can increase cognitive impairment? Or just cause cognitive impairment? That's a weird way to word it. Amazing job. When's y'all's exam? Oh, Thursday. Okay, great. Y'all are doing great for it being on Thursday. I would always hate when tutors were like, "Oh, y'all should know it by now," and I'm like, "Honey, it is a couple days before. Calm down." Okay, so how should we react with an Alzheimer's patient who is having negative reactions? Yep, always be remain calm and reassuring. Okay, a nurse is counseling a parent whose patient has a communication disorder. What would the nurse emphasize when educating the parent? Okay, though red, that option like does sound good. The important part is to initiate conversations with the child because you do want to give them the opportunity to speak and like practice those skills in a non-judgmental way in a safe environment. So just initiate those conversations frequently and allow like a safe space for them to speak. Okay, a nurse is assessing a child who's suspected of having ADHD. What shows impulsiveness? Okay, this one's actually tricky now that I see, but I just remembered the right answer. Okay, good. Oh my gosh, y'all did so good. I could see why someone would want to put yellow, but yeah, it is the risk-taking behavior. That's why I emphasize that so much. Okay, the nurse initiates a behavioral treatment program for a child with oncoparesis. This is what I was trying to tell y'all about. And what's the first like intervention? Before you do anything, what's the first intervention? Okay, I know why all of y'all put green. It was in red on the slide. This is what I was trying to remember whenever I was telling y'all about this. So before like you start any kind of like bowel training or using the restroom after each meal, you want to just cleanse the bowel and have like a clean slate. So remember that clean slate, bowel cleanse first before you start those behavioral practices. Ooh, nice. You're climbing high. Okay. A nurse is assessing a girl that's 8 years old with mood disorders. Which of the following would the nurse expect to assess? They're 8 years old, remember. Yeah, behavioral problems, exactly. So if someone's acting out or having a lot of conduct issues, remember that like assess their behavioral problems because don't just skip to thinking they're a terrible child or whatever. They could present their mood disorder behaviorally. Oh, doing great. Push on through. Okay, an autism patient is rocking back and forth. What do you do? Okay, so yes, patting the area is like kind of like a safety. Oh shoot, that scared me. Thank you. Um, Although patting the area is like a safety concern and you think, yeah, you do that for a seizure, rocking, unless they're like banging their head against the wall and it's like they're harming themselves, you just ignore it. That's just a coping mechanism patients with autism do. And you just want to let them do it. They are self-soothing. Exactly. Exactly. So just ignore it, let them do it. Don't be judgmental unless they're hurting themselves. Just let them do their thing. A patient has an intellectual disability. Sorry, there's a question mark there. What do you teach the family to be a goal? What's the goal? Oh, also, FXN is function. Okay, perfect. Y'all are geniuses. I had a stroke trying to read function. Sorry. Okay. A child with a tic disorder is prescribed an antipsychotic agent as a part of his treatment plan. Um, the nurse expects to be what to be prescribed. Yeah, aripiprazole. Yeah. Okay. XY chromosome, boy or girl? Hey, great. Just making sure y'all are awake. Okay, during the health history, a client reports that she experiences pain during sexual intercourse. The nurse documents this as what? Pain during sexual intercourse. That's a wonderful memory trick. I love that, Corian. Why do boys exist? I'm just kidding. They're wonderful. I love y'all. Yep, good job. And anyone in the chat want to tell me what the red one is? Sad. Great. Wonderful. Good job, guys. Y'all are so much fun, I swear. Miriam, if I told you right now, I would be making it up, so I don't remember. Kendra, thank you. I appreciate that. A nurse is discussing strategies to enhance sleep with a client who's experiencing insomnia. What would you do? This one's just super easy. I feel like sleep hygiene is like a, oh, thank God I love this question. I will get my 2 points. Yeah, establish a regular time to go to bed and getting up in the morning, just kind of like training your body, kind of like bowel training. You're just like training your body to be in this like little system. I do have to say though, like warm milk was like an answer to one HESI question. So whenever we get to the HESIs, we'll help you with that. Okay, what patient statement depicts narcolepsy? I feel like y'all can get this. Oh, amazing. Y'all are perfect. A client with insomnia is taught to avoid watching TV, eating, and doing work in bed. Which technique is being used? Yep, stimulus control. Good job. Last one. What is sleep latency? Sorry, I don't have a Kardashian meme. It's been a busy day. Yeah, it's pretty much the time from like trying to fall asleep and actually falling asleep. Y'all did great. Who is it? Oh, yay. And feel free to stick around for any questions, comments, concerns. I am happy to be here for y'all. Y'all are amazing and will do so well. And please feel free to message me and group me if there's like a private thing you want to talk about. I know some of y'all message me privately on here. It's just like really hard. Oh, you're so welcome. I had fun with y'all. Y'all are great. You're so welcome. Y'all have a good night. Get some rest.